Welcome to the first edition of Here's to Your Health. My name is Marcia Radloff, and I practice Oriental medicine and acupuncture in downtown Watertown, Wisconsin. And we're here with this program to help introduce people in the community to alternative medicine practices that are available to them. Many people are unaware of what alternative medicine can do for them, and we would like to introduce practitioners from the community who you can seek out for alternative medicine practices. This show is all about your health. It's about regaining your health and keeping your health. So welcome to the first edition of Here's to Your Health. The first thing we're going to cover today is complementary and alternative medicine practices that are available in your community. And here to discuss these with me today is Tom Radloff, a registered yoga instructor from Watertown.
Hello, everybody.
Okay, the first thing we'll go through today is traditional Chinese medicine, also known as Oriental medicine. The most well-known modality of Chinese medicine that people here are familiar with is acupuncture. So I'm the acupuncturist in Watertown. It's new for Watertown. I've been in the community for about 3 years doing acupuncture here. Acupuncture is helpful for all types of disorders, including internal problems and pain syndromes.
What does acupuncture exactly do?
Acupuncture moves energy. It moves qi and blood and thereby helps relieve pain and helps relieve internal problems as well. Herbal medicine is another part of acupuncture, or another part of traditional Chinese medicine, something that a lot of people are familiar with. Herbal medicine is very safe, cost-effective, without side effects. That's one of the greatest benefits of alternative medicine, is you don't have the side effects that you have with Western-type treatments.
Do herbs, or what is an herb compared to a vitamin? Is that something, are they, how do they differ?
An herb is a plant, and a certain portion of the plant that is used for treating problems in the body. Vitamins are tiny complexes within foods and plants. So herbs are more like medicine, and vitamins are pieces that are gotten from food for wellness.
So, everybody can use herbs then, so instead of drug treatments then?
Herbs are safe for most people to use. Occasionally when there are too many medications being used, it's just not possible to prescribe herbs because of interactions with medications, but each patient is looked at on a case-by-case basis. Herbs are very safe. There are alternatives for most prescription medications in the herbal pharmacy. So we try to help patients get well so that they can go back to their prescribing doctor and wean off of prescription medications which have side effects. But that takes time.
So herbs are basically a more natural approach to a drug that don't upset the mechanisms of the body like maybe a prescription drug does then, correct on that?
Yeah, a lot of drugs actually originally came from plants or plant parts or herbs, not so much today anymore. And prescription medications do positive things in the body, but the problem is that they have side effects. So with herbal medicine, it's possible to avoid side effects.
And so if I was a regular person out there in life and I would want to try an herb, where would I find it? Who would I go to? You?
Natural practitioners, an herbalist. The person might be called a master herbalist, a doctor of Oriental medicine, an acupuncturist. A lot of herbs are available over the counter at a health food store. But when you're using traditional Chinese medicine, you have to go through a practitioner to receive the herbs, and there's good reason for that. Herbs can be harmful if they're not used the right way, so you need to receive them from someone who's been trained in how to prescribe them.
And where do you get your training to do this?
There's colleges all around the country. In Wisconsin, the Midwest College of Oriental Medicine is the training facility for acupuncturists and doctors of Oriental medicine.
And that's where you got your training from?
That's where my training is from.
Okay.
The next alternative practice that I want to talk about today is naturopathy. Naturopathy is the practice of allowing nature to heal the body. And practitioners of naturopathy are called naturopathic physicians, doctors of naturopathic medicine. We don't have a lot of them in Wisconsin, and sometimes they're difficult to find because they are not licensed by the state here. So they generally work under medical doctors in a community in order to be able to legally do medicine here, because Wisconsin doesn't have a law for them. But they are excellent practitioners. They look at the whole body, mind, and spirit.
What are some of the other healing modalities that people use in the area for natural healing?
There's naturopathy, Ayurvedic medicine, Reiki, craniosacral, therapeutic massage, and chiropractic. And we'll be going over those topics in more detail in future television shows. Okay, the next thing we'd like to go through today are 10 tips for healthy living. Number one, drink plenty of pure, clean water every day. And what does that mean? For most individuals, half your body weight in ounces of water is the proper amount for you to get every day. So if you weigh 200 pounds, you need about 100 ounces of fresh, clean, purified water every day. This is very important for good health.
And is bottled water, is that considered good, clean water?
Bottled water is okay. It's better if you purify your own water at the source. A reverse osmosis with a charcoal filter, that's the best kind of system to have in your home. But the second best choice would be purified water that you purchase in a bottle. The issue with bottled water is there's BPA, there's xenoestrogens and things that leach into the water. But we all have to do the best that we can, and it is very important for us to get enough water, so we want to just drink the best source of water that we can get.
So you're saying that our best source is basically the water from our tap, but it should be purified with some kind of a filter system to drink your water.
Right.
Okay?
All right, number two, during your breaks at work, take a brisk walk, even if it's only for 5 minutes.
Why only 5 minutes? Is that all you need for exercise?
Actually, walk more if you can walk more, but if you only have 5 minutes, use the 5 minutes to walk, because it'll raise your metabolism up, it'll get oxygen flowing through your body, and it'll clear your brain out. It's just a good practice.
I'll work on that every day then.
Okay.
Thank you.
Number three, do mindful breathing for 5 minutes every day. If you can find the time, do more.
Why breathe? What kind of effect does that have? Don't we just breathe by ourselves? You know, isn't that just a natural act?
It is a natural act, but mindful breathing is paying attention to your breathing, which allows you to shut out the rest of what's going on around you and allows your body to relax.
So do we attain this by what how do we breathe? Do we breathe deep into our belly then, don't we then? Deep belly breathing? Is that what?
And deep chest breathing as well.
Deep chest breathing.
Yeah.
Okay.
Full body breathing. Breathe deeply, count the breaths in, breathe out, count the breaths out. That keeps your mind focused on the breathing.
Also great stress relief too.
Yep, great stress reliever. Number four, eat food provided by nature, not food provided by factories.
So what does that mean exactly? I mean, isn't all foods provided by a factory in some way or another?
No. Foods that you find around the perimeter of your grocery store are the foods provided by nature. So fruits and vegetables, all the produce in the produce department, meat department, dairy department, eggs. These are foods provided by nature, unchanged. So meat, dairy, eggs, produce. In the inside of the grocery store, in the aisles, you'll find packaged, boxed goods that are no longer living food. All the enzymes have been killed in the processing and they are no longer health-giving foods.
They're also loaded full of chemicals and
Yes.
so basically what you're telling me is anything with a barcode we probably shouldn't eat.
Probably not.
Okay.
Number 5, take whole food vitamins, not chemical vitamins. There's a big difference.
Well, what is that difference, Dr. Marcia?
Whole food vitamins are made from food. The whole food is taken, the water is removed, the fiber is removed, and what's left is pressed into a tablet. That would be called a whole food supplement. A vitamin that you buy over the counter is made from chemicals in a laboratory similar to a medication and is unfamiliar to your body. Your body doesn't know how to utilize that type of a vitamin and can actually be a stress to someone who is ill rather than a benefit.
So going to the store, or where do I find a whole food supplement? I mean, do I buy that at the local Shopko GNC, or do I go to a special, who handles whole food supplements?
I sell whole food supplements in my office. Many alternative medicine practitioners sell whole food supplements. You can find some whole food supplements in a health food store. You need to have someone who's familiar with the product to help you choose what's safe and what's healthy. So when you read the ingredients label of a vitamin, you should see food in the ingredients label, not things like calcium carbonate or D-alpha tocopherol. Those are chemically made vitamins.
So so basically you should read labels when you buy your vitamins.
Read the label and look for food.
Look and be educated on what is a synthetic vitamin.
Right.
Okay.
Very important.
Okay.
Number 6, if the bugs won't eat something, neither should you.
Sorry, sorry. I'm trying not to laugh. I mean, that's well.